This presentation will look at emergent issues within the field of health and wellness. My name is Andy McCullough. I'm a doctoral candidate at American College of Education. I'm completing a doctorate in education in leadership with a focus of study in health and wellness. A little about me is I'm a licensed professional counselor practicing in Little Rock, Arkansas. I'm a clinician, a clinical leader, and a clinical educator. I am the clinical director of a nonprofit agency. I provide direct services to at-risk students as well as pregnant and parenting women. And I provide clinical education and supervision for graduate level students hoping to enter the counseling field. Now, 2020 being the year of the virus, literally the year in which the COVID-19 virus hangs like a cloud over the world, you'll notice that there are two important elements to these emergent issues. First, there's a connection to COVID-19. COVID-19 has illustrated the best and the worst of modern healthcare. Secondly, these issues are seen through the lens that I bring to the table, my experience as a behavioral health care provider. I will first look at health and wellness versus the practice of medicine. 2, the delivery of telehealth services. 3, the development of social connection in the recovery process in a time of isolation. 4, professional development of new practitioners. And 5, the emergence of online education. Please join me in the following slides. Thank you. One of the most important emergent issues within health and wellness is a greater understanding within the United States of the value of the practice of health and wellness. Too often, the American experience with the healthcare system focuses on the practice of medicine. Doctors and nurses often are the face of healthcare in the United States. Healthcare is far more broader than the practice of medicine. The COVID-19 pandemic has helped illustrate how important healthcare activities beyond medicine are for the well-being of the public. Prevention, the ability to care for one's needs. These are as important, if not more important today, than the practice of medicine. In fact, the COVID-19 pandemic, with no vaccines and no therapeutics available and limited ability of hospitals to treat the needs of these patients, illustrates the shortcomings of medicine and highlight the benefits of an effective and robust healthcare system that focuses both on medicine and health and wellness. The National Commission on Health Education Credentialing looks at health as a multidisciplinary practice, multidimensional practice. SAMHSA, the Substance Abuse Mental Health Service Administration, also sees health and wellness as being a multidimensional practice, with medicine being a small part of it. Now, the commission that accredits health educators sees health and wellness as a practice with 7 dimensions that include program design and management, evaluation and research, coalition and community building, health literacy and communication, curriculum development, motivational interviewing, the ability to move people and help people make good decisions, and capacity building. It's clear with the COVID-19 and the efforts to address this pandemic and to keep people from getting sick, that people have seen these 7 dimensions in action. Likewise, SAMHSA takes a look at health and wellness from a holistic view. Some of the dimensions from SAMHSA's point of view have absolutely nothing to do with medicine. In fact, emotional well-being is at the forefront of SAMHSA effort. As a practicing counselor, I see emotional well-being as essential to wellness. First, people that want to get well, people that want to not get sick, people that feel good about themselves, people that are able to cope with stress, feel better. The cloud that currently is over the United States and the world due to COVID has increased stress levels remarkably. The ability to manage that stress in a healthy manner is key to staying well. SAMHSA also looks at environmental, financial, intellectual, occupational, physical, social, and spiritual dimensions of wellness. So, the first emergent issue I identify in health and wellness at the moment, underneath this cloud of COVID-19, is health and wellness versus the practice of medicine. The community, I think, for the first time in a long time, is seeing that the practice of medicine is not necessarily synonymous with good health and wellness. COVID-19 has helped healthcare providers identify shortcomings in the healthcare delivery system. Traditionally, healthcare in the United States has been a storefront operation. Clients come to providers. Now, obviously, this has created haves and have-nots within the healthcare system. Individuals that live in developed areas, metropolitan areas, cities, have always had great choice in obtaining health care. There are primary providers, there are specialists, there are mental health providers. There are people to meet their needs. People that live in rural communities have always traditionally had fewer choices. The pandemic, the COVID-19 pandemic that we're facing at present has changed the whole storefront approach to healthcare. Individuals are finding locked doors when they need them. Dentists have closed their doors. PCPs are not seeing their patients. Hospitals have limited their services to individuals with COVID or individuals presenting with very acute illnesses. Mental health facilities are not seeing people in person. Telehealth has emerged as a very important issue in healthcare in 2020. Now, telehealth is not a new concept. Telehealth has been in existence for several years. However, it has traditionally been aimed at those more rural communities. Arkansas, where I practice, is a rural state. The University of Arkansas for Medical Science, which is the leading healthcare provider in Arkansas, has had programs to connect rural patients and rural providers with specialists at the hospitals. Tertiary services have been provided by telehealth traditionally. Other practitioners, such as licensed professional counselors, have had the ability to obtain the training to provide telephone services. However, most providers have not practiced telehealth due to discomfort, inexperience, lack of demand. The COVID-19 pandemic has changed this. PCPs are having telehealth sessions with clients and patients who live within a mile or two of the office. The safety of both the provider and the patient make telehealth a convenient option. a necessary option. Now, as this virus passes in the next several weeks, the next several months, telehealth will have taken root in the United States. Practitioners who had never considered this as an option will be well versed in the provision of telehealth. Patients and clients who had never considered seeing a practitioner through video link or through telephone calls have become more used to the practice and will insist on it within the future. One of the barriers to telehealth services has always been reimbursement by insurance companies. Many insurance companies, the commercial carriers such as Blue Cross, United Health, Cigna, have limited reimbursement for telehealth when providers have been close enough to provide face-to-face services. Medicaid and Medicaid have had similar restrictions. This pandemic has loosened those restrictions, and most practitioners believe that those restrictions will forever be gone. This perhaps may be the most important benefit that emerges from this healthcare crisis. Another of the emergent issues in the health and wellness arena are issues regarding the recovery from substance use disorders. Addiction, both alcoholism and drug addiction, as well as some of the more common process addictions such as gambling addiction, traditionally has been treated through social connection. Group therapy and support groups have been essential for behavior change. Now, COVID-19 has limited social interaction. Alcoholics Anonymous, Narcotics Anonymous, Celebrate Recovery, Sex Addicts Anonymous, the multitude of support groups have not been meeting in person. Individuals in recovery are finding themselves isolated. Now, isolation was a symptom of the addiction. It was one of the reasons alcoholics and drug addicts use substances. Isolation was a byproduct of that use. The lack of face-to-face, one-on-one recovery activities has put a lot of these individuals in recovery at risk of relapse. Now, Alcoholics Anonymous, Narcotics Anonymous have both been holding Zoom meetings. These organizations have had parking lot meetings where individuals can engage in meetings at a healthy distance. However, individuals that participate in both Zoom meetings and parking lot meetings indicate that the lack of connection, the lack of intimacy, the lack of one-to-one interaction is minimizing these efforts. So one of the emergent issues that is coming up in 2020 as Americans respond to the COVID-19 epidemic is how is social connection promoted while a nation is isolating? There is no answer to this at the time, and it's an issue that needs further attention. And it needs further attention to promote the well-being of these individuals who are working hard for their recovery. Professional development was the focus of my dissertation. I completed a dissertation looking at the clinical supervision of professional counselors and clinical social workers in Arkansas. The findings from this dissertation was that clinical supervision, when it's done well, is not about the transfer of knowledge from expert to novice, but rather the relationship that develops between expert and novice. One of the emergent issues in 2020 as we deal with the COVID-19 crisis is that it's hard to maintain an effective professional connection between expert and novice. This, like treatment issues previously addressed, this is an issue that needs to be addressed for the development of the next generation of healthcare providers. Now, even before COVID-19, this was an emergent issue. Nurses had grasped this issue and were addressing it through ways to take first-year nurses and help them develop greater competency. Nursing programs had developed residencies for first-year nurses in which novice nurses had been matched with more experienced preceptors to help these nurses through first-year issues. Now, my dissertation, the study, found that although traditionally the transfer of knowledge is one of the issues that happens within these developmental relationships, that the relationship itself is more important than that transfer of knowledge. That new professionals need a supportive expert to help in this development in the new field. That the new professional can develop better within a supportive environment. So as the training of new professionals grows, the efforts need to be made to provide greater support and one-on-one attention between new professional and expert. One of the emergent issues that has really been brought to light by the COVID-19 pandemic is the role of online education. Now, as schools across the country, both primary and secondary, colleges and universities, as these schools have closed down and students have gone from the classroom to the home, the value of online education or familiarity with online education has been universal. However, not everyone has embraced the value of online education. The healthcare field is one of the fields that has never truly embraced the value of online education. Obviously, part of this is due to the fact that healthcare, particularly the practice of medicine and the practice of counseling and the practice of nursing, these are disciplines that require one-on-one interactions. Very hard to train a professional for one-on-one interactions without two people in the same room. However, the transfer of knowledge, the theory, the technique, the literature, all the background that's required for these educations can be delivered quite well in an online format. So the pairing of online preparation with residencies, with practicums, with internships, makes the online education as valuable as education obtained within a brick and mortar institution. Now, as a professional counselor, the accreditation body for counselors, CACREP, was an early adopter of online education. When I entered Capella University in 2006, CACREP had accredited the institution, and I understood there could be some value with that diploma. The Council of Social Work Education has accredited online programs for social workers. The nursing accreditation bodies have begun to accredit master's degree programs to prepare nurse practitioners as well as nurse educators. Now, nurses at the lower degree levels still need to be trained at brick and mortar institutions, at least for the hands-on part of their education. Medical schools continue to engage in online, in-person learning with some adjunct online courses. This pandemic, I think one of the most important benefits or outcomes of this is that the value and the necessity of online education is going to be embraced throughout the United States. This is an opportunity for instructors and professors at online institutions to promote the value and the equity of an online education and the parity with a brick and mortar institution. It's also important that graduates of online programs engage in professional communities and speak up and share that they were academically prepared at an online institution and promote their competence. Only through these sort of interactions will online education find true parity with brick and mortar institutions and acceptance within the community. Thank you.